I think what I've noticed in this particular directing council is the level of discussion. There were certain presentations that are set up by a process. You know, documents are written and prepared by our technical teams, they're circulated, they're vetted in the executive committee, which is a smaller meeting in June. Suggestions are made. So there's a lot of homework going into the directing council that I think is demonstrated by the breadth and richness of the discussion. I noticed several topics, climate change, for example. Several countries had comments. There were interventions, for example, on the antimicrobial resistance, on reducing maternal mortality. So for me, comparing it to other years, it seemed very rich in the discussion. And I think that reflects, to a large extent, all the homework, all the hard work that was done in advance, with countries, of course, doing their homework, reading the documents, providing the commentaries. So I thought it was exemplary from that standpoint. Well, you know, it's a great question because in the old days it was all infectious diseases. You know, we talk about yellow fever, we talk about vaccine preventable diseases, HIV, tuberculosis, malaria, the neglected tropical diseases. The focus was on those themes. Those themes are still highly important, but we're now, for the first time in history, seeing more people die from chronic diseases. So it's something that we have to readjust and balance the overall health discussion. So I think your question's excellent because it reflects now that balance where we recognize there's a tremendous need. There's a call for action to address the chronic diseases because, as we know, the cost related to doing nothing will be impossible for countries to handle in the future, in the next 20, 30 years. So the call for action is action now. There's simple things we can do. So all that, I was very pleased to see that balance. And because chronic disease is related to health determinants, and health determinants are related to what's going on with our environment and climate change, they're all interrelated. And so I think we captured that. And we didn't lose sight of the fact that we still have to maintain our status as a region free of measles, rubella, polio. We still have the challenge of reducing the morbidity and mortality of influenza. Yellow fever is still a huge issue for some countries, the emergence of dengue and so on. So we have that balance, and I'm real pleased to see it. Well, the role of the Secretariat is to continue to ensure, going into the Directing Council, that we maintain technical excellence. So the documents, the homework that I referred to, is grounded in the best evidence so that when the discussions are being conducted, the policy that's developed, those resolutions, is based on the best available scientific evidence that we have. The policy is adopted, and then our job, in many cases, we had a plan of action that was associated with the resolution. And so that plan of action is a roadmap for going forward. For our Secretariat to provide assistance to countries, it's the job of the Ministries of Health to implement those actions and monitor and evaluate progress, but we're there to help as technical experts and to lend a hand. I think that's the beauty of our organization. We are global public servants, and so for each country we're a civil servant there to support the national program, and it's grounded in that plan of action. My skin is tingling because it was so much fun and exciting for us to produce this supplement to a journal such as the Journal of Infectious Disease. It's a highly reputable, scientific, peer-reviewed journal. And the supplement was dedicated to the elimination of rubella and congenital rubella syndrome in the Americas. It was a compilation of 29 articles, all peer-reviewed, that basically describes the best practices, basically describes the incredible commitment and hard work, strategies that were implemented to achieve a target, which was 0 cases of congenital rubella syndrome in our region, a very debilitating disease. Like polio, leaves children devastated with substantial morbidity. It could be mental retardation, for example. It could be blindness due to the cataracts, or hearing loss, or the heart defects, or any combination of those things. And so it's a tremendous burden on families to care for a child that has congenital rubella syndrome. It's caused by the rubella virus. A mother who is pregnant, if she gets infected with this virus in her first 10 weeks of pregnancy, she has a 90% chance of delivering a baby with this syndrome. So the fact that we can eradicate it and, going into the future, expect to have no more cases of this terrible syndrome, I think it was great. And the purpose of the publication was to document that, and to do so using one of the best journals, so that anywhere in the world it was believable. It had this peer review, it was factual, plus that had the prestige, and that was, I think, exciting. And working with countries, we started this process 4 years ago, before the target had been achieved, so we needed to accumulate the experience, then document it, and then write these articles. We had a great group of editors. I was asked to be the guest editor. We also had Carlos Castillo and Cuauhtemoc Ruiz Matus. Then we had a group of associate editors that actually helped us also. And they were colleagues from the Centers for Disease Control and from our own staff, like Gina Tambini and Christina Marsigli as well. And so it was a team effort. And there were 2 phases to the review. The group that I just mentioned, led by myself, Carlos, and Cuauhtemoc, supported by those others, we conducted the first phase of the review. And then the second phase, once we gave the clearance, which is back and forth with the first author in country, it could be in Brazil, or it could be in Honduras, and exchanging our comments, making those revisions. After that was done, then there was a second phase. The article then was submitted to the journal, where they have and maintain a list of independent reviewers, editors on their staff, and then they provided their criticisms, their comments. In some cases there were very few, in other cases there were some that we really had to go back to the country and make sure that the article complied with all the quality that we set the bar at. So it was a challenge, and largely because if you're an EPI manager working in a country, you're worried about vaccinating every day. You're worried about your cold chain. You're worried about your team working. You're worried about the logistics. You don't have time to sit down and write an article. So that was the challenge. But they did it, and they knew and wanted to get the word out and document. So the compilation of all that experience in these 29 articles really, I think, is historical. So it was just an amazing experience, and very humbling in that sense, that we supported countries to do this.